Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Robynne Chutkan, a renowned gastroenterologist on the faculty of Georgetown University and founder of the Digestive Center for Women, who has spearheaded extensive efforts to diagnose and treat microbial discord in the gut. A graduate of Yale and Columbia College of Physicians and Surgeons, Dr. Chutkan is also author of several best-selling digestive health books, The Microbiome Solution, Gut Bliss, and The Bloat Cure, and a frequent guest and contributor on the Dr. Oz Show. Well, welcome, Dr. Chutkan. Thank you so much for joining us today, right off the main stage with your incredibly informative and inspiring keynote. We are here at A4M's 25th Anniversary Spring Congress. What would you say would be your most important message that you would hope to have delivered to the like-minded individuals in the audience today?
I think there really is a revolution afoot in healthcare, and I think that your members and the people in the audience are all part of it, along with the patients. It's such an exciting time to be a physician right now in medicine, or really a healthcare practitioner, because the message of optimism, and particularly in my area of expertise with the microbiome, the change that's possible is so exciting. And I tell patients all the time, you know, the microbiome that you have today is not the one you're going to wake up with tomorrow. And the ability to really transform our health and to be the architects of our health, and for us as practitioners to be guiding people in that, it's such an optimistic message.
So let's go back to the beginning of your medical journey. So you were born in Jamaica?
Yes.
And when did you come to the U.S.?
I was born in Jamaica. My father is an orthopedic surgeon of Indian descent, and my mom is a dancer / college professor / lawyer, a very dynamic woman. She's Jamaican. And I lived there until I was 13, and then my parents migrated to the Bahamas. And I lived there for a little bit, lots of beach time, went to school there for a couple of years, and then was in boarding school in France and Spain. I came to the U.S. in 1983 for college to New Haven. And it was a little bit of a shock. I didn't know anyone in the entire state of Connecticut, but everyone spoke English, so that was very helpful. And I spent 4 years in New Haven.
And a shabby school called Yale.
Yes. And
You're very
that's
modest.
code for Yale, New Haven. And then 10 years in New York at Columbia for medical school residency, a year as chief resident. And then I did my GI fellowship at Mount Sinai. And then I've been in Washington, D.C. since 1997 on faculty at Georgetown and for the whole time, and then opened my own practice, the Digestive Center for Women, which is now the Digestive Center for Wellness, because I realize that men are pretty interested in gut health too. And that's been wonderful, having really both sides of that relationship, having my academic affiliation and involvement with the training program and being able to influence the training and some of the younger generation who are very savvy and know a lot more than I did when I was in their position. And at the same time, having my private practice where I have full autonomy and creative control. So it's been a good marriage.
So what initially sparked your interest in going into GI?
My father's an orthopedic surgeon. My brother's an orthopedic surgeon. I was bound and determined that I was going to be an orthopedic surgeon. And within about 7 minutes of my orthopedic surgery rotation, I realized I am not cut out for this. This is carpentry. Actually, obviously, there's a lot more to orthopedics, but the whole surgical subspecialties, too, it was a little hierarchical for me. It was a little yes sir, no sir saluting, and it didn't appeal to my anti-establishment streak. So I realized that orthopedic surgery was not for me, and then I thought maybe general surgery. But gastroenterology really appealed to me because there is a surgical aspect of it. You are doing procedures and you are entering the body. But the range of conditions and patients is so broad, and that really appealed to me. You're taking care of men and women and old and young and people with very serious autoimmune disease and even cancer, and people who just have digestive distress and are not that sick. And I also really wanted to be the kind of doctor who, if my neighbor ever got sick or collapsed, I would know what to do. So some of the really, really specialized fields, I worried if I were a radiation oncologist and, would I really know what to do if somebody were having a heart attack? I'm sure there are many radiation oncologists who do, but I like the fact that gastroenterology was broad yet specific in some ways, and it meant that you could see a wide breadth of disease even while sort of subspecializing in one area.
So what was the inspiration for you to transition your practice from a traditional practice of Western medicine into a functional or wellness approach?
I did my gastroenterology training at Mount Sinai, where doctors Crohn, Oppenheimer, and Ginsburg first described Crohn's disease, at the time known as regional enteritis or terminal enteritis, in the 1930s. Of course, that's not when I did my training. But I was in this long tradition of gastroenterologists. Dr. Crohn begat Dr. Henry Janowitz, who begat Dr. David Sacker, who begat me, and a whole generation of gastroenterologists. And as incredible as the training was, one of the really interesting things was at the time when I was completing my gastroenterology fellowship in the 1990s, this idea that you could actually heal the bowel and treat inflammatory bowel disease without medication was heresy. I mean, that was just something that the very idea of it didn't exist. There were lesser drugs and they were more aggressive drugs, and there was a sense of, there was a line of the drugs, the 5-ASAs and so on, that were less toxic but also less effective. And then within the course of my medical career, biologics, monoclonal antibodies, and so on, and of course steroids that were more effective but also more toxic with less desirable side effects. So it was sort of, which side of the line do you want to be on, and you try and stay below the line and use the drugs that are safer but less effective and hope for the best. But the idea that you could use no drugs at all was magical thinking. And I still remember saying to patients early on in my inflammatory bowel disease clinic in Washington at Georgetown, saying to patients who were non-compliant or self-determined, saying, you know, not being on drugs for your Crohn's disease is sort of like driving a car without insurance. You might be okay, but chances are you're going to get into an accident and you're really going to be in trouble. Because it just did not seem possible that the disease could go into remission without some sort of pharmaceutical remedy, and typically one with a not so desirable side effect profile. When I started seeing patients who had changed their diet profoundly and were also often using mind-body techniques of meditation and yoga, sometimes acupuncture, etc., and their disease was healed, it was shocking to me in the beginning. It was terrifying, actually, because I thought, something bad's going to happen. How can this be? And I remember the very first patient. She was somebody who actually worked at Georgetown. She had Crohn's disease. We were about the same age. She had very severe Crohn's disease. She'd been on a lot of drugs. She left Georgetown and went to work in New Jersey and came back a couple years later. And I remember seeing her in clinic and asking her what she was on, and she said nothing. And she told me about this diet that at the time, almost 20 years ago, seemed so outlandish. She had cut out dairy, she had cut out bread and pasta and most rice. She was eating healthy, lean protein, lots of vegetables, lots of nuts, lots of fruit, and she felt great. And I thought, well, let's see what's going on inside. And I remember doing her colonoscopy and looking at her ileum, which had been very inflamed and ulcerated and really a lot of active disease, and it looked normal. And I couldn't believe it. And I remember distinctly asking her, you must be taking something, kind of prodding her, like there must be something you're not telling me. And it really was a diet. And that was, that really just sort of ignited a fire in me, quite frankly, to find out how this worked and what this was. And so I had the privilege of taking care of lots of patients who were really generous in sharing with me what they were doing. I remember there was a conference, a young investigators conference in Capri, Italy. And at the time, I still qualified as a young investigator. I think you had to be under 31 or under 35. And I really wanted to go to this conference. So I decided I'm going to do something that's different from the typical pharmaceutical intervention. So we did a study in my IBD clinic asking patients about their use of complementary and alternative practices. And what we found was that an astounding 70%, which is pretty high for 20 years ago, 70% of patients were using some sort of complementary alternative medical technique, typically in conjunction with what I was prescribing for their Crohn's disease. And there was a little bit of an don't ask, don't tell, because at the time, and I still think today, a lot of conventionally trained physicians can be judgmental about this. You know, you're doing what? You're taking what? That doesn't work. And so many of them were doing these things in conjunction with what was being traditionally prescribed, but they weren't really telling their physician about it. So I turned that into an abstract, which got accepted for the meeting in Capri, and I went to this meeting. And again, that really got me thinking, gosh, people are doing this, and it's actually working.
How was it received?
It was received in a tepid manner. It was seen as, well, that's not real medicine, what you're talking about. People taking fish oil and Chinese herbs and meditating isn't really medicine. These are, your hipster patients who are out there. So it's really interesting. In some ways, it's changed a lot, and in some ways it's changed not at all. But I think there's a really growing audience of informed and interested physicians and other healthcare practitioners who believe and who often have had a personal transformative story, as I've had. And my personal story was really by proxy with the birth of my daughter in 2005. I had a healthy pregnancy, other than being advanced maternal age at 39. Was in great health. I swam, snowboard, running, yoga, and had a very uneventful pregnancy right up until the time of delivery, where I had a prolonged labor. I had an epidural. I didn't know at the time that probably increased my chances of a C-section. It certainly felt good to have that needle in my back and that pain relief. And I ended up having a C-section. I had the flu at the time of my delivery, and because of that, I had a fever and there was meconium. So they did a C-section, and they took my daughter and put her in the NICU, which again, at the time I thought, this is great. They're being so proactive. They're doing a sepsis workup. They're giving her IV antibiotics prophylactically. I didn't know anything about the microbiome and its importance back then, or very little. And I thought that taking a newborn born via C-section and giving her IV antibiotics was a good idea, because this was probably helpful in case there was active infection, even though she was fine with high APGAR scores and no evidence of anything wrong. And that set off a series of unfortunate events of her being sick literally every 1 to 2 months and receiving more and more antibiotics, and we just couldn't break the cycle. She was 2 when she got norovirus and ended up in the hospital and started to develop some kidney and liver failure and was very, very sick. And I just kept thinking, why is she so sick all the time? It literally was like clockwork every month. And our very well-meaning pediatrician would look at her chart. She'd sort of look at the last page and say, oh, well, she got amoxicillin last time. Let's give her something else. And finally, I pulled out all the prescriptions. I'm an obsessive filer, and made a spreadsheet and realized that she had been on almost 20 courses of antibiotics, and she was not yet in preschool. The final straw for me was one Thanksgiving. We were getting ready to go to South Carolina to visit my husband's family, and my daughter was sick, as she frequently was, but with a hacking, lingering cough. And my husband insisted that we take her to the doctor. And by that time, I was pretty fed up, and I thought, let's not go to the doctor. They're just going to give her another antibiotic. But he insisted. So I said, you take her. And they went, and she came in the door. She was about 4, holding a nebulizer with stickers and 4 prescriptions: an antibiotic, a steroid, an antihistamine, and some sort of inhaler for the machine. And I thought, what's going on? She doesn't have asthma. Why are they giving us 4 prescriptions? And I packed it all up and I put it in the attic. And that's when I said, I'm done. Now, I realize that as a physician, I have additional knowledge and training that allowed me to make that decision. And certainly we do go to the doctor if somebody's really sick in the house. I certainly don't advise the average non-healthcare professional to take that approach. But I had this fear that if we kept going down this path, we were seeing an allergist who said she had fluid in her air, and the solution was just to put her on antibiotics open-ended until the fluid cleared. And it wasn't so much that I was aware of statistics like the fact that 5 days of a broad-spectrum antibiotic can remove 1/3 of your gut bacteria, and chances are they're never coming back, and what that means.
You were aware of that statistic at the time?
No, I was not aware of that. I was not aware of statistics like the fact that 5 days of a broad-spectrum antibiotic can remove 1/3 of your gut bacteria. But I was aware that we had been going down this path of frequent antibiotics and steroids and other medications, and not only was she not getting better, she was getting worse. So without knowing what I didn't know, and without knowing what I know now, I knew that what we were doing was not working and was a bad idea. And at the same time, on a parallel track, I was noticing in so many of my patients with Crohn's disease and ulcerative colitis that they had a similar history. to my daughter Sydney that they had had frequent antibiotics throughout childhood, had been C-section babies, hadn't been nursed for extensive periods of time because of breast milk drying up, likely because of the antibiotics I received in the hospital. So I was seeing this parallel path of children who had a history very similar to Sydney's, and who would then ending up with being diagnosed with Crohn's or ulcerative colitis or other autoimmune phenomena in their early teens or early 20s. So I knew that I had to do something differently. And my instinct was just, let's stop going to the doctor when she's sick and try some different things and see. And I remember the first few times that she had a high fever and a sore throat, or ears, and I would always take her to get swabbed for strep. I was always a little afraid of that. And I said, we're just going to tough it out and see. And I have to tell you, the first couple of years were tough going. She was sick a lot. She missed a lot of school. But after a couple of years, I really noticed light at the end of the tunnel, and I noticed that she would be sick for shorter intervals of time, and the intervals of time between illnesses were growing longer, and she was just bouncing back much faster. Now, there was a lot of stuffing her full of as many green smoothies as she would tolerate, which is tricky and probably the most challenging part of parenting, getting your kids to eat more vegetables and less junk. But there was definitely a dietary change along with that. And nothing strict, nothing needs to be 100%. And I really try and counsel my patients. I'm an adult gastroenterologist, but for my patients who are dealing with children who have issues, it's less about your child never eating mac and cheese and more about your child eating more vegetables consistently. You can drown out a lot of mac and cheese with enough spinach and kale and broccoli and so on. So really getting our children to develop a palate, and adults too, where they don't reject the more bitter greens, and they understand the role that those foods play in maintaining a healthy microbiome, a healthy gut, and essentially a healthy body. And that really starts at a very young age. So we try not to be very absolute about what she can and can't eat. And absolute doesn't work with 12-year-olds either in terms of diet. But getting her to buy in to my green smoothie in the morning, and she still holds her nose and complains and says, why does she have to drink swamp juice? But it's such an important part of what I see as creating a healthy terrain for her, and trying to explain to her that her immune system is a little abnormal because it has been so manipulated by all these antibiotics at an early age, so she's more susceptible to certain things. So it's been really rewarding. We still do go to the doctor from time to time, but we try and reserve that for a broken bone or something really important. And for these more minor illnesses, green juice, green smoothies, bone broth, rest, maybe a little binge watching of Netflix, that seems to go a long way.
I'm sure spiritually as well.
Yes.
So what was the catalyst then, or how did you initially take this approach within your practice in treating your own patients?
So as I mentioned, I've been on the faculty at Georgetown Hospital since 1997, and I have wonderful colleagues there. But I found that my practice there was very oriented towards doing procedures. And when you do the math and you think about the income that's generated by gastroenterologists doing colonoscopy, mostly in healthy people, mostly screening colonoscopy, or in people with minor problems, versus the heavy lifting of sitting down and talking to somebody about their history and their diet and lifestyle, it's a pretty imbalanced equation. And so at Georgetown, I had wonderful colleagues. I was very well treated. I was very well remunerated, but I didn't feel as though I was really making a difference in my patients' lives. I really didn't have the forum to sit and to talk to patients about diet and lifestyle and to intervene in a way, in a meaningful way, because of course it's much more than saying eat this, don't eat that. You really have to give people the tools. There's a lot of hand-holding and coaching that has to go along with it. And it just wasn't the right setting to do that. So in 2004, while pregnant and gutting a house, I decided to open my own practice. And at the time, it was called the Digestive Center for Women, because the idea was that women were more interested in food as medicine and were more interested in lifestyle interventions and so on. Since then, I've come to realize that men are just as interested, many of them, and we're now the Digestive Center for Wellness. But I opened a practice with a nutritionist on board and somebody who does biofeedback, which is very helpful, not just with people with anismus and who have a tight sphincter, getting them to relax for constipation, but also for people who have, quote unquote, real disease, people who have serious Crohn's and ulcerative colitis and even colon cancer. Biofeedback can be a tremendous source of relief for their digestive symptoms. And we paid a lot of attention to what people were eating and how they were living. And it was fun to be able to explore in that way with the patients, to really be in it with them and learning together. They appreciate the time that I took. I saw a tremendous drop in income, and that was challenging to realize that when you're not doing screening colonoscopy over and over, day after day, when you're sitting there talking to patients, you're going to make less money, and that's something that I had to reconcile myself to. But it feels very good to do this sort of work I'm doing. I consider myself a conventionally trained but informed physician. I still wear a white coat most of the time. I have a prescription pad. I use it mostly to prescribe probiotics these days. And our area of expertise, if you will, these days is still primarily inflammatory bowel diseases, but it is really on prescribing. We are the practice that people come to get off of steroids, to get off of Imuran, to get off of infliximab and other monoclonal antibodies, and to learn more about the role of nutrition in treating autoimmune diseases. We're not 100% successful. Our success rate for using a primarily plant-based diet to treat autoimmune diseases is probably somewhere around 75 to 80%. So pretty good, but not perfect. There are definitely patients we see who have such a deep level of cellular microbial damage that they just really don't get better no matter what we do and no matter how much kale they eat. And I'm glad that we have really effective drugs to use in a lot of those patients. But again, judicious use is really important. So exhausting the modalities that are not harmful and potentially helpful, and then saying, okay, this isn't working, we have to turn to something more aggressive, tends to be our approach. And these days we also see a tremendous amount of patients with this sort of general label of dysbiosis, of altered gut bacteria, many of whom have GI manifestations, whether it's bloating or gas or diarrhea or so on, manifestations of leaky gut, but some of whom have other autoimmune diseases, vitiligo, MS, rheumatoid arthritis, various things. I try and stay in my zone as a gastroenterologist, and I try and be very clear with patients who are coming to see me for non-GI issues that I don't have a magic wand to wave, and that there are things that we can do. We can analyze their microbiome, we can look at their habits, we can make some very robust dietary recommendations, but there's no guarantee that we can fix their autoimmune disease because, again, disease is a complex interplay of lots of different things: genetic background, environmental influences, immune regulation. Some of the factors we know and can control, many of them are as yet undescribed. But that's why it's so wonderful to be a part of this revolution, if you will, and this community of healthcare practitioners who have their eyes and ears open and who are looking who are looking with new eyes, if you will, on the horizon for new modalities of therapy, some sophisticated, some basic, and are open to the idea that there's still a lot of learning ahead.
So how have you implemented this in your teachings at Georgetown?
Because I started at Georgetown essentially 20 years ago in 1997 and have a good relationship with my colleagues there, I mean, they really are my family, my work family. I think that they have embraced a lot of this.
So you haven't had any pushback from them?
I've had some pushback, but what's really interesting is that many of my referrals come from my colleagues. I would say most of my referrals come from my GI colleagues. So they'll say to the patient, well, that's not really my thing. We've done the endoscopy and everything's fine, but you should go see my colleague, Robynne Chutkan, if you want to talk about that stuff. She knows about that stuff. So there's an acknowledgement that there is stuff to be talked about outside of the endoscopic stuff that they're doing. And I think that's a huge step. So I love when I get referrals from my GI colleagues. And I always say to patients, don't abandon your doctor, even if it seems as though you don't speak the same language. Because I was that doctor not so long ago who didn't speak this language and who didn't understand. And because of the goodwill of patients and colleagues along the way who brought me along and opened my eyes and showed me what was possible, I'm where I am today. So I think all of us have a debt to bring a colleague along and to try and open people's eyes and open their minds and let them see what's possible. And it's not abandoning conventional medicine. It is really having a broader view of what it means to be a healthcare practitioner today.
What do you think it will take for the medical schools to start implementing this on a broader scope where it's far more accepted?
I'm a fan of some of these old medical shows. I love watching the London Hospital, which is set in 1908, or the Nick. So these are shows that are 100 years ago, essentially. And the London Hospital is actually recreated from medical records and newspaper reports and so on of the first charity hospital in the East End of London in the early part of the 1900s, with cholera outbreaks and TB and so on. And when I watch these shows, what is so interesting is fast forward, 108 years later, we're still crawling around in the darkness on our hands and knees, clearly. And you look at what was going on then, when they were radiating boils because there were no antibiotics, so they're using radiation for abscesses and furuncles, which was often effective, but of course people got cancer and died. And it was bring on the leeches, or they were doing phlebotomy for different things. And you look at how they recommended these things with such authority and such certainty, and really in the best interests of the patients. I mean, these are well-meaning people, as we are today, but they really had no idea. And I think we have gone not a long distance in that time. So I think the thing that we all need to do is we need to be skeptics. We need to have eyes wide open when we're recommending these things, whether it's a new drug or a new procedure or a new test, and we need to really think about downstream what may be happening. And as I like to tell my patients, nothing is free. You can take that Advil, but it's going to come at a cost because it's doing something to your gut. It's helping your knee pain, but it's doing something to your gut. So to really understand how we weigh the risk-benefit profile of things is really important, and the costs. In my practice, I think the biggest change has been to move away from the reflex prescribing and into the implementation of nutritional and lifestyle changes. And I'll tell you, it's exhausting. It's exhausting. It's exhausting in my own life, getting up and making my green smoothie and doing all this stuff. But the benefits are so clear that I can't not do it. And we tell people right up front, this is not easy. This is not just, I'm not going to prescribe a probiotic and we're done. You really have to change. You have to start shopping for food and cooking food, preparing food. This has to be on your radar. And as I like to say, if it's 3 o'clock and you don't know what you're having for dinner, that's not good. You're probably having something you shouldn't be eating. So really convincing people that this is worthwhile, that making this sort of investment in their health and their family's health is going to pay off is a hard sell, but it is what I believe in. And I got to the point where I could not, in good conscience, sit across the desk from patients and recommend drugs that I myself would not want to take or would not want my child to take unless we had exhausted all the other possibilities. So for me, it became a little bit of my moral compass and feeling like I had to do this. I had to at least try. And it's a lot of fun.
How much time do you spend with a patient typically?
I spend about an hour and 15 minutes with a new patient and half an hour with a follow-up, typically. It's sometimes a little longer. We sometimes do phone consults because we have a lot of patients who live outside of the Washington, D.C. area, so we'll do phone follow-ups that are 15 minutes just to find out how somebody's doing. But typically it's a fairly lengthy initial visit, and we review the records ahead of time so that hour and 15 minutes is really spent with the patient, finding out more about what's going on.
It's remarkable. So how have you implemented this? I know you do your green juices and your daughter's doing her yucky green juice in the morning. What else have you done to implement these practices into your life?
So I do want to point out green smoothie, not green juice, because as much as I love green juices, all that fibrous stuff that you throw out after you juice, that's exactly what you need to be putting into your gut to feed the good bacteria. So it's smoothies where you're blending up the vegetables so that it's all that indigestible plant fiber. That's the key. So we have this saying, live dirty, eat clean. and there's lots of living dirty in our household, which is enchanting for my 12-year-old because there's a lot less bathing and washing of hair. She has a very long, thick mane of curly hair, and hair washing can be traumatic. So we pay a little less attention, if you will, to personal hygiene. And I try and do a little quick rinse off when I'm going to be in close company like today, but I spend far less time scrubbing and washing all the oils out of my hair and skin and then trying to replace them with store-bought versions. And we're at the farmer's market every Sunday. We try and buy food that actually was grown in the dirt. Organic is great, but there's also a lot of industrial organic. So making sure that food was grown in healthy soil, ideally in a biodynamic closed-loop cycle where the animals are fertilizing it. And so we do a lot of that, and that's a lot of fun, heading to the farmer's market on a Sunday. We are runners. Our daughter recently, she just did her first half marathon here in Florida, in Miami, in January at age 11, Amazing. Just before her 12th birthday. That was super exciting. I believe in the redemptive powers of sweat as well as green vegetables. So we do try and get sweaty most days. We eat primarily a plant-based diet. We also eat some poultry and fish and occasional red meat, but we try and eat a lot of plants. I have a wicked sweet tooth, so I try and keep that in check with dark chocolate and fruit-based treats, but that is something that continues to be a challenge. But again, I take the long view and the approach that I recommend to my patients, which is, if you ate a pint of Haagen-Dazs, it's not the end of the world. Go have a kale salad and see what you can do about it. So trying to keep things balanced. And it's not about eating a perfect diet, but it's really about paying attention to the amount of indigestible plant fiber and making sure that you're feeding your microbes on a daily basis.
So you still have dairy and gluten in your diet and your daughter's diet?
We're about 80% compliant in terms of being gluten-free, dairy-free, sugar-free, etc. I don't buy stuff that has gluten in it at home, but outside of the home, I don't police my daughter, and I know there's a lot of pizza and cupcakes happening at birthday parties and sleepovers, and again, we try and drown it out with some healthy food at home. I don't feel well when I eat a lot of gluten. I can tolerate a little bit and some soy sauce, but if I have a bagel or a piece of bread, I tend to get very, very tired. And so I generally avoid it. We eat very little dairy, a little bit of cheese every now and again, and maybe some occasional yogurt once a month, but not a lot of dairy because, again, I feel better off of dairy, and I definitely notice with my daughter, with her symptoms, she gets a lot of gas and other symptoms that she's better not having it. So that, again, that's part of the challenge is what do middle schoolers like to eat? Dairy, wheat, sugar. So trying to make sure that she has lots of stuff that tastes good to her to eat, in addition to just the hardcore green smoothies, you have to have it, but trying to bake in a way where stuff tastes good, but it's healthier, using more almond flour and coconut flour and honey, as opposed to wheat flour and sugar and dairy.
Does she try to impart her wisdom that she's acquired to her friends?
Oh, she absolutely does. So she considers herself the microbiome expert, but it's interesting. So when she's in the setting of her friends who are pretty uninformed, and some of them, unfortunately, not healthy eaters, she's the expert. But then at home, she still complains that she has to have all of this. And so when friends come for sleepovers, she sort of says, oh, Mom, make the green smoothie so they can see what I have to suffer through. Right. So she's not quite sure in some ways whether this is a blessing or a curse. She hasn't quite figured that out.
So can we talk about you a little bit more personally? I know you'd mentioned that you snowboard and run. What else do you like to do in your off days? Downtime?
I like off days. The amount of days I'm actually in the office is a well-guarded secret, and my office staff knows to say she's not available rather than she's not here, she's at yoga. And I remind myself when I feel guilty that I have to do these things, like go running and hike in Rock Creek Park and do yoga and make green smoothies, do things that keep me healthy that I admonish my patients to do. And if I'm in the office all day long seeing patients from morning to night every day, that I'm not a good role model. But it's just funny, my dad is an orthopedic surgeon, and he's very, he sort of nose to the grindstone. And when I call him from the car, he's always like, oh, you're not in the office? And I'm like, no, Dad, I'm going to yoga so that I don't end up with cardiovascular disease like you had because you worked all the time. So I remind myself that this is all very good. I played squash in college. I grew up in a squash family. My parents played. They both, at 82 and 78, are very good squash players and tennis. And I played in college, and after a long hiatus of a few decades, I'm playing squash again with my daughter, which is really exciting. She's a skier. My husband and I are snowboarders. It's kind of flipped from what you'd expect, right? The older guys are supposed to ski and the younger ones snowboard, but we're the snowboarders. I'm a very slow but enthusiastic marathon runner. So I've done about 6 or 7 marathons and a bunch of half marathons. Still have not got my sub-4 time. I'm still hovering above 4 hours. So that's one of the things on my bucket list, is to run a marathon in less than 4 hours. And as the knees get older, it gets a little more challenging, but I'm going to get there. I know I will.
What else is on your bucket list?
I would like to climb Mount Kilimanjaro. It was supposed to happen last year, but my husband arranged it as a surprise, and it was not possible for me to.
How can you do that as a surprise?
Exactly. I couldn't cancel 3 weeks of patients on short notice, so
but isn't there also
didn't make it.
preparation that's involved with that and training?
There's some preparation. So we're hoping to get to Kilimanjaro. That's definitely on the bucket list. A sub-4 marathon. I'd like to learn how to play the guitar. And I am not a good stick shift driver. I don't know why, but I'd like to make sure if there's an emergency and the only car available is stick shift, I'd like to feel like I would not shut off doing that. So those are definitely some of the ones on my bucket list. I'm aspirationally vegan because I think that the way animals are reared for human consumption these days is awful. But I have to say, when I go completely vegan, and I don't know if it's psychological because I just miss the meat. My vegan friends would tell me it's just psychological. I feel like I don't feel quite as well as when I have some animal protein. So I continue to wrestle with that on a personal level. From a medical and a health point of view, I think you can incorporate some animal protein into your diet and be healthy with enough plant protein. But from a moral and ethical and let's save the planet point of view, I definitely think that if more of us ate no animals, we'd all be better off. So I continue to wrestle with that one very deeply in my own life. And I remember we got a puppy a couple years ago, and when Hugo came into our lives, I felt very guilty. And I said to my daughter one day, I said, I feel so guilty eating this chicken in front of Hugo. And she was about 10 at the time, and she looked at me and she said, why? Hugo eats chicken. And I thought, I was like, yeah, that's true. But the way we eat chicken is different from the way that an animal in the wild would eat a chicken. And that's what I continue to wrestle with. So I try to eat lots of plants every day. Sometimes I'm very successful, sometimes less so. And still wrestle with this idea of, is it possible to eat animals in a humane and compassionate way that is good for the planet? Do I have to get out there with my longbow on the plains, or is there a way to do it? And I have interesting conversations with my great vegan friends like Rich Roll and Jenna Hamshaw and other folks, and Neil Barnard, who I think have made huge contributions to our state of health and medicine. But I think that there are probably multiple ways to do it. I don't think there's any one perfect diet. There are diets that are better for you as an individual and worse, and there are diets that are better for the planet and worse. And I think all of us need to sort of find our own way.
What do you hope that your legacy would be?
I hope to make myself superfluous. I think that healthcare has been hijacked by the pharmaceutical industry, by the medical industry, by the insurance industry, by the hospital industry. And I think that we have used the same scare, terror tactics that they've used in that industry. My husband happens to be a federal agent who does counterterrorism and counterintelligence, and so I won't be too critical of that industry. But people are very scared. They're very fearful about their health. They don't understand where disease comes from. They think it falls out of the sky into their laps. They think they need to do a lot of tests and take a lot of drugs to prevent that from happening. I would like my legacy to be empowering people, giving them the tools to feel less fearful about what may happen to them, to their families, and understanding that we do actually have a lot of control. We don't have ultimate control. Sometimes bad things do fall out of the sky into our laps, but we have a lot of control. And it happens really early on. In fact, it happens before we're even born with what our parents are eating, what our mothers in particular. So I want to give people the tools and the understanding so that they can feel more in control of their health and less fearful, and so that they don't have to come and see me, and I can become a farmer or open a green smoothie joint, and I can wave at them at the farmer's market or on the yoga mat. And that really ultimately is the goal, to be less busy. It's a little bit of a nihilistic goal, but that's really what it is.
So do you have another book in the works?
My first book was Gut Bliss, which was a lot of fun writing. And although I was an English major in college, I wasn't a writer, and I wrote every word of it, so I'm very proud of it. The Microbiome Solution, I think, is an important book, because that really, I think that really put into words a lot of what is going on, and a lot of the research and so on. The third book was a quickie, The Bloat Cure. Not my best, 101 Things That Bloat You. It's sort of a book for maybe a less sophisticated audience. So my fourth book that I'm just percolating about now, I think is going to be a little more personal, and I'm thinking about something along the lines of trying to be dirty in a clean world. That's something that chronicles myself and my family's struggles, knowing what we know, but also living in the real world. How can we be healthier? And I'll give you an example. We are in the process of building a house, and my husband wants to put a pool in the back. And I'm like, a pool? That's terrible. If the bacteria don't get you, the chlorine will. In fact, I'm more scared of the chlorine than I am of the bacteria. I said, a pool is a terrible idea. And I want to put a mud pit in. I want to put in a pit where we compost all the vegetables and maybe a little night soil, and create this incredibly robust, microbially rich and diverse soil that we will go and dip in and invite our friends to dip in. And so my husband is like, really? And you're saying that we might even poo in that, or get animals to poo in it, and then invite our neighbors over to come soak in it? What planet are you living in? So I'm trying to explain to him that, this actually might be worthwhile. So we're having this incredible knockdown, drag out battle over pool versus mud pit.
Are there contractors for that?
The contractors would build the shell. And so these are some of the struggles we have, or the debate with at what level of pungency do you allow your 12-year-old to not bathe anymore? And my husband keeps saying, she needs deodorant. And I'm like, no, deodorant is terrible, because it kills off the healthy bacteria and allows the unhealthy bacteria to overgrow, and you actually become smellier, and you need more deodorant, and deodorant begets deodorant. And he's like, yes, but she's going to be known as the smelly girl who nobody wants to sit beside. And I'm saying, you have to deodorize from the inside out. And so it can become quite comical at times. So I feel like I have one foot in both worlds. I mean, conventional medicine, there's some things about it that are great, but there's some things about it that are not so great. And the alternative world, there's some things about it that are great, but there are also some not so great things. And I don't think that most people find good health in a shopping bag full of supplements, for example. I'm as wary of the supplement industry as I am of the conventionally prescribed drugs. And I think there's overdiagnosing and overprescribing, overtesting on both sides. And I think most people are like me. We're sort of in the middle, trying to straddle both worlds and just trying to figure out what can work for us and our families. And so I'm thinking of something that's a little more personal, a little more humorous, a little less doctor on high in her white coat giving information, but a little more of a look into my medical practice and my life and the challenges that even someone like me, who's a very, very, very well-informed consumer, faces. And is there a way to really rewild without going all the way back to the cave? Is there a way to rewild within the wilds of an urban environment in Washington, D.C.? We live right in the city. And how do you do that? You can't sort of go to school or work covered in mud, even if you have a mud pit. And what do you do about the water supply? Do you need your own well? And do you have to grow all your own food? And should I have a couple goats in my backyard? Is there a way to sort of responsibly and reliably try and grow a healthy gut garden without going all the way back to the cave?
One last question for you. So what advice would you give to a physician who was on the verge of transitioning their practice to a wellness practice? What advice would you give them to motivate them to do so? and not be afraid?
If you're on the verge of transitioning, I think the most important thing is to start to think about the company you keep. Surround yourself with like-minded practitioners. Go to a conference. Come to A4M. Go to Food is Medicine. There's so many fantastic conferences out there. There are courses at Kripalu and all over. Go to the Plantrition Project. And again, come to A4M. Go to conferences where there are people like you. There are people who are conventionally trained but whose practice is shifting, and hear about the research, hear about the things people are doing. I think it's super important because it's very isolating often when you have this sense that the way you're doing things is not the ideal way to do things, but all your colleagues do it that way, and there's almost sometimes a sense of ridicule, like, well, that's not real medicine, and what's that hippie stuff you're recommending? So it's important to find a community of like-minded practitioners who are practicing good evidence-based medicine. There's a ton of research out there. Find it, read it, and be around colleagues who have the same belief system and the same values. And if you build it, they will come. Patients are dying to see practitioners who have this orientation, who are open to the idea of maybe more bugs, less drugs.
Thank you so much.